Hello, everybody in Language and the Pandemic Conference. My name is Ghada Abdurrahim Al-Sulami. The title of the paper I'm going to present today is Semantic Analysis of Using Xphemistic Expressions in Saudi Health Minister Speeches During COVID-19 Pandemic. The outline of this presentation would be as follows: Introduction, Scope of the Study, Theoretical Background, Objectives and Questions, then Methodology, Results, Conclusion, and References. Over the centuries, the world has experienced episodes of infectious disease outbreaks such as Ebola, SARS, and H1N1 influenza, which is famously known as the Spanish flu. As we all know, nowadays the ongoing spread of COVID-19 disease has currently developed to cause a serious public threat to all human health. Such crisis directed the scientists and researchers' attentions all over the world from different fields towards stepping up in response to this challenge for the purpose of understanding it from different point of views. From linguistic side, there are different modes of communication between governments and their nation in order to strengthen the solidarity in such critical situation. In the case of Saudi Health Minister Tawfig bin Fawzan Al-Rabiah, the Saudis found his speeches to be more milder and comfortable. This is because of his careful use of linguistic choice, which sound to be indirect, direct, and formal representation of the sensitive matter while addressing the Saudi people. This act is included under what is linguistically known as the use of euphemism, dysphemism, and orthophemism. So that leads us to the scope of the study, which is first to investigate resources where euphemistic, dysphemistic, and orthophemistic expressions come as characteristics in the speeches of the Saudi Health Minister during the pandemic, and also to examine how war and euphemistic strategies 1992 are appeared in the speeches of Saudi Health Minister by analyzing his speech using thematic analysis approach. The theoretical framework upon which the study is built is the theory of euphemisms. Allen and Borge 1991-2006 evaluate the way in which language mediates the sociocultural production of offensive expressions in situated context of use. Finally, they categorize the linguistic expressions into three main classes, namely euphemism, dysphemism, and orthophemism. The union set of these three terms forming the concept of euphemism. As we can see here, they define euphemism as an alternative to a dispreferred expression in order to avoid possible loss of face. For example, when someone replaced the word doorman with access controller, so the expression access controller would be more polite and less direct. On the other hand, they define dysphemism as an expression with connotations that are offensive either about the denotatum or the audience. For example, when someone says snuff it instead of die, so the expression snuff it is harsh and blunt and used to offend something or someone. Moreover, they define orthophemisms as the straight, literal, or neutral talk or expression. So we can say that orthophemisms means stating the fact as it is without any attempt to make the speech less direct or to make it more harder. So it's not sweet-sounded like euphemism, neither harsh or blunt like dysphemism. So, for example, when someone call someone as a fat, without any attempt to make the speech less harder. The second theoretical background is the formation of euphemisms. In both the spoken and written discourse, euphemistic expression can be established through different ways and strategies. But linguistically speaking, we can say that the use of dysphemisms and orthophemism do not need any employment of tools or devices other than the using of literal and straight form of the word. However, forming euphemisms require applying different linguistic strategies to revolve around the word meaning in order to create a new expression. So one of the most detailed taxonomies of euphemism or for forming euphemism has been suggested by Warren in 1992. She develops her model of euphemistic strategies based on Allen and Borge 1991. The main idea of Warren model is that the novel contextual meaning, which are the new expression of or the new meaning of the word in a specific context, are continually produced in any language. Eventually, she divides the euphemistic strategies into three main categories, including formal innovation, phonemic modification, and semantic innovation. Each categories including strategies such as, for example, for the first category, which is formal innovation, including strategies such as compounding and derivation or blends. As for phonemic modification, it includes strategies such as backslang, rhyming slang, or abbreviation. However, for semantic innovation, including strategies such as particularizations, implications, metaphors, or metonymies. Regarding the related studies in the literature, we can say that the amount of the studies in the literature that examine the euphemistic expressions and euphemistic strategies in the medical discourse are little, comparing to other types of discourse such as political discourse or public discourse. And this claim can be supported by Rabiah 2014 when she argued that although the issue of euphemisms has been marginally mentioned in some studies, it has not been basically studied enough in the medical discourse. Such studies including but not limited to these 6 studies. However, we can say that most of these papers have basically studies the use of euphemisms without the other sides of the coin, which are dysphemism and orthophemism. So we can consider that the gap in the literature, which is the current study, is going to fill. As we can see here, there are 3 main objectives of the study. First, investigate how Saudi Minister of Health delivers the health message about COVID-19 crisis to the Saudi people. Second, provide an analysis of how the minister deals with euphemistic expressions in his speeches during the health crisis. Third, examine the most frequent strategies for forming euphemisms in the speeches of the Saudi health minister during the crisis. So, accordingly, the study seeks to answer the following research questions. First, how does the health message about COVID-19 crisis delivered to the Saudi by the minister? Second, how does the Saudi health minister deal with the euphemistic expressions in his speeches during the pandemic? Third, what are the most frequent strategies for forming euphemisms in the speeches of Saudi health minister? So, as we can see here, the collected data of this research is the 8 speeches delivered by the Saudi Minister of Health, Tawfig bin Fawzan Al-Rabiah, during the health pandemic or the health crisis. The amount of the duration of these 8 speeches combined is approximately 24 minutes. The study qualitatively analyzed these speeches using thematic analysis approach. Thematic analysis involves coding and categorizing all the transcribed data before analyzing the key themes accordingly. The transcripts of the speeches can be classified thematically into 3 main linguistic classifications, namely, as we said before, euphemisms, dysphemisms, and orthophemisms. The formation of each classification is related to some specific themes in the speeches. So, as we can see here on this slide, there are 3 main themes in which the euphemistic expressions are created by the minister. Each euphemistic expression in those themes is formed by specific euphemistic strategies from Warren model of euphemistic strategies. So, as we can see here, the first theme is presenting unpleasant messages. In this theme, the minister uses 2 euphemistic strategies, which are reversal and implication. Reversal is a strategy by which the affirmative statement is described by using its negative form to make the utterance sound less direct or more polite. As an example of reversal strategies is when the minister say they are not being serious enough with the danger of the pandemic. So in this example, the fact that some people are reckless is substituted with more euphemistic one when he uses the reversal expression, which is they are not being serious enough. The second strategy is implication. Implication is a strategy by which the dispreferred meaning is implied inside a new expression by the speaker. As an example, here we can say when the minister says, before it's too late. Here the minister was informing the Saudi people that the Saudi ministry were saving people's lives before it's too late. So instead of saying the dispreferred meaning of saying before they die, he applied the euphemistic expression, which is before it's too late. The second theme in which the euphemistic expressions were created by the minister is naming the health crisis. In this theme, he uses 2 strategies as well, which is particularizations and metonymies. Particularization is a device to create euphemism by using general term within particularized context to indicate a topic. However, metonymy is a strategy in which the conventional meaning of a term is referred to by the contextual meaning of that term. So we can say that the difference between particularizations and metonymy is that in metonymy, the new meaning and the conventional meaning is semantically related. However, in particularization, the two meanings are semantically unrelated. As an example of that, we can see here the minister uses the term big challenge to refer to the health crisis instead of mentioning the health crisis directly. The term challenge here is applied in particular context as a referent to COVID-19 pandemic without any related meaning or any semantically related meaning between these two expressions. However, as an example of metonymy here, the minister uses the word the disease as a substitute of the literary name of the disease with indirect terms of COVID-19 by saying just the disease without mentioning the name directly. So this linguistic act has been commonly used in Arabic societies. We usually say the word the disease or refer to the disease with saying the disease without mentioning his name directly. The third theme in which the minister created euphemistic expression is comforting the public. So here the minister just uses one strategy to construct this theme here, which is metaphor. Metaphor is a formulation of a new concept through comparison. As an example of metaphor in the minister's speech is here when he says, we will reach the safe shore through our commitment. Here, the minister resembles the hard health crisis to a journey in the sea, and our commitment is the way of reaching the other destination safely. Here, this slide shows the frequency of using euphemistic strategies by the minister. It's clearly shown that reversal strategies or reversal strategy ranks the highest frequency level by 14 times. In contrast, metaphorical euphemism has the lowest level by 5 times. With regard to other strategies, reversal strategies is employed by the minister 10 times, followed by particularization strategies with 9 times, and finally metonymy by 7 times. So here we can say that, or we can conclude the euphemisms by saying that these 5 main strategies used by the the health minister is falling into the semantic innovation categories from Warren euphemistic strategies model. As for dysphemisms, as we can see here, the minister implemented dysphemistic expressions just in one theme, which is describing the virus. For example, when he says, what passes on the world right now is a pandemic in every sense of the word. Also when he says, it's a danger in all of us. These expressions are adopted by the minister to express his apprehension of a negative attribute of the COVID-19. By using this expression, he is trying to dysphemize or offend the pandemic. So that is to say, the minister introduces such expressions by using blunt or hard replacement for the pandemic name. As for orthophemisms, the analysis shows that there are 3 main themes in which the orthophemistic expressions are implemented by the minister. First one is declaring facts and update about the pandemic. For example, when he says, the next stage will be harder in the international level. Also when he says, we need to take more procedures to protect us and the society. Here, the minister uses straightforward language to inform the public of the difficulties that the world will face in the next stage and to notify them to the importance of taking more measures to save them from being infected with coronavirus. The second theme in which the orthophemisms is implemented is warning the public. For example, when he says, the lack of commitment will make us compelled to take precautionary measures to protect the societies. Here, this expression is regarded as a warning for people that if they do not follow the instructions of maintaining social distance, the government will need to demand more precautionary actions. The third theme in which the orthophemisms is applied by the minister is requesting to follow instructions. For example, when he say, I want from my citizens and residents to help us in following the demanded measures with complete accuracy and high responsibility to avoid reaching developed stage regarding the increasing of the infected cases. Here, the minister literally demands the citizens and the residents to carefully follow the health measures. So asking the request with official and neutral expressions without any revolving around the word meanings motivate people to follow his demand and to express the seriousness of the health situation. Last but not least, the paper concluded that the employment of each euphemisms by the minister is mainly occurred within certain thematic fields. That is to mean the messages about COVID-19 pandemic have been delivered thematically by the minister using the three euphemistic expressions, which are euphemisms, dysphemisms, and orthophemisms. Moreover, the implementation of euphemistic strategies by the minister is connected to the themes. Different strategies are used because of the difference of the themes. So these findings contribute to the limited examination of pandemic discourse by providing reader with the importance of applying different linguistic choices while addressing the public in time of crisis. Finally, it's recommended to connect a comparative study with another health minister in another culture within the same pandemic to see the cultural differences while addressing the public in time of pandemic such as COVID-19. These are the references used to build up this presentation, and these are my contact informations. That's the end of my presentation. Thank you for listening.